I will let you know and invite you all to our support groups. Of course, we meet every Friday at 11 a.m. For a support group. And then on Saturday, this Saturday, we're doing our monthly support group that focuses on grief. So the grief of just being a caregiver for somebody with a dementia diagnosis, but even grief after somebody's physically passed. And that is a monthly, like I said, support group, and that meets the second Saturday of every month. So that is this Saturday, and it's from 10:30 till noon. But this afternoon, I will send you a list of our upcoming programs along with how to register for those. And of course, a copy of these slides today and the recording. But we are going to dive deep today into malnourishment and vitamin deficiency and the effects that that has on brain health. We did a program not too long ago about just other brain disorders, because not everything that causes memory loss and confusion and poor judgment and changes in personality, those things that do come along with a progressive dementia diagnosis, not everything is caused by dementia, Alzheimer's disease, vascular dementia, Lewy body dementia, you name it. There's many reasons why somebody might be having some cognitive impairment. So it is important to get a proper diagnosis. We want to make sure that the symptoms that somebody's exhibiting, or myself is exhibiting, I want to make sure I'm being treated for the right thing. So that does take a proper diagnosis, and a diagnosis can take a couple of hours, several hours, because it's a ruling out process. They want to rule out everything. They want to rule out to make sure it's not a vitamin deficiency. They want to rule out another, it's a medication interaction, or rule out depression and anxiety. Those things, it can be managed or treated, or it's an infection or something like that. Let's rule all these things out before to see if we have a progressive dementia diagnosis, or if it's something else, another brain disorder that can be treated or managed or even reversed or fixed. So malnourishment and vitamin deficiency can be one of those causes of a short-term dementia. But it can also lead to a longer-term dementia. But if somebody has dementia or another chronic illness and they have malnourishment or vitamin deficiency, it can make that illness worse. So we want to make sure we're treating it correctly. But talking about or defining malnutrition and vitamin deficiency, it's just when a person's diet doesn't provide enough nutrients, enough minerals in the right balance of it for optimal health. And when we say the word diet, in fact, one of those 4-letter words, right? But diet is really just what you eat. We're all on a diet. Some of us have healthier choices. Some of us have unhealthy choices or less healthy choices. And that changes depending on what season of life we're in, or depending on what time of day it is too, I know that in the morning I can resist some of those. I can resist the donut and some of the sugary things. In the afternoon, it's harder for me to do that. And I think we all go through those phases throughout the day and throughout our lives as well. But we really want to talk about our diet and making sure that we're getting a good balance of those right nutrients, hydration, and the minerals that we can get from food to make sure all of our optimal health, brain health, heart health, kidney health, all of those are working the best that it can. When you think about malnourishment and vitamin deficiency, a couple of things is that it affects all groups of people. So 9 million older adults cannot afford nutritious food. So a group of older adults that have lower income, that's a group of people. 1 in 4 adults that are 65 and older will either skip meals or reduce the size of their meals. Up to 60% of adults in healthcare settings are malnourished. In this health, in community living, a hospital, hospice, things like that. And 16% of independent older adults are at high risk for malnutrition. And we'll talk about causes and risk factors for this. But the other thing is it affects all sizes. Because we think, oh, somebody's malnourished, they have some vitamin deficiency, they're generally underweight. But it affects all sizes. You can be underweight or overweight. And this is grossly overweight or grossly underweight. your body is not getting the right nutrients, that balance of nutrients and minerals that it needs. About 715,000 adults, in the US, 65 plus are underweight, but about 1/3 US adults 65 plus are overweight. And about 60% again of older adults in healthcare settings are malnourished, but 16% are at high risk for malnutrition. So causes and risk factors, what creates or the causes of this malnourishment? And there's several reasons for it. It can just be a reduced intake of food due to a mental issue or to poor appetite. It can be COVID-19. I know that one of the symptoms is a loss of taste and smell. I know I don't have those senses or those receptors working, then I'm not interested in food. My body's not going to make it hungry, right? I don't have the appetite to eat. It can be you're just feeling sick, you got a sore throat. It can be allergies. It can be a whole slew of things, or you just have a poor appetite. So you're not getting as much food as you normally would, or that maybe that your body actually needs. Mobility problems. And this can be physically mobile. It's hard for me to get out of the chair, go to the kitchen, kind of cook something because I got to sit down. Or I'm just recovered from surgery and I can't really move, things like that. But it's also mobility like transportation as well. I can't get to the grocery store to get proper food, or I can't get to a restaurant to get that food and not have anybody to take me, can't get to the bus, things like that. Just chronic conditions and illnesses that we're living with can reduce our appetite or can cause some malnourishment. Limited income. Like I said, a lot of older adults are on reduced income, and the choice to spend money on food may not be, that top 10, maybe living, it may be grandchildren. It may be food for the animal or for the pet and not for me. Living alone in isolation. Medication side effects can decrease appetite, of course, or just any other type. Medication side effects can have cause gastrointestinal or GI issues, nausea and stuff. So that's going to make me not want to eat. Depression, dementia, of course, as well. I don't remember to eat, or I think I already ate, or I just don't think about it. Or that feeling of hunger, I'm not recognizing that feeling of hunger, and I can't plan my day out either. Fad diets. A lot of fad diets do not have the balance of nutrients that our body needs. It's we're trying to be a quick fix to lose a lot of weight real quick, but your body's not getting the nutrients that it needs. Any other kind of gastrointestinal disorder, you have excessive fat, excessive sodium, excessive sugar in your diet. Again, that's not a balance of the nutrients that we need, right? And then your body might just have an issue of absorbing certain nutrients. And this is where some vitamin deficiency can come in that we'll talk about a little bit later. And chronic eating disorders, such as anorexia or bulimia, maybe you struggled with that at a younger age and now it's kind of coming back up, or you never managed it very well in the first place. You're having trouble swallowing or chewing and you have poor dental health. If I have my gums hurt or I have sore in my mouth, I'm certainly not going to want to eat. Other digestive disorders, alcoholism or abuse of alcohol and drugs can certainly cause malnutrition. And then an excessive loss of nutrients. And this can be an acute diarrhea or vomiting or dialysis as well that's not managed, or the treatment plan for it's not managed very well. So a variety of causes and a variety of risk factors that can cause somebody to be malnourished or get a vitamin deficiency. And again, I will say it affects all sizes and all groups of people, because you can get plenty of food, but it's just not the right food. I think, vegetarians or vegans, they eat probably a lot of food, but how much of them are actually eating more processed food and more carbohydrates like chips and crackers and breads, and they're getting the nutrients out of that stuff, but are they filling in that loss of nutrients like of protein or something with different plant-based stuff? Of course, different people, but it's really what nutrients are you getting from the food that you eat? You might be getting plenty of food, you might be eating too much of food, but what nutrients are you getting from it? So the effects of malnourishment and aging. So what this looks like and what it can do. It's going to hurt our muscles and our bones. As we age, just a normal part of it, we do have some muscle loss and the bone density loss. That's a normal part of it. But being malnourished accelerates those losses, and it impacts our life, really. It's going to impact our mobility faster. It's going to accelerate that, or more severely. Because if I fall, right, and now I have the loss of bone density, it's going to be harder for me to recover, and I might continue to fall over and over again. I have poor posture. I'm just not strong. My strength has left me because I get that weakness. Killing an immune system. When we're malnourished, that lack of nutrients that's in our body, it decreases our white blood cell count. And our white blood cell count is what helps heal us and keep us healthy. When we get an infection or anything, a sickness, those white blood cells get over there and help us recover and get us better. When we're malnourished, we don't have as many white blood cells, and it makes it much harder for our body to fight off infection, fight off any type of illness. It's going to take us a lot longer to recover or heal from an illness or a wound, anything like that. But it also increases your risk to get or to become ill or get an infection. So not only it's harder for us to get rid of it, we're going to be more susceptible to getting illness and getting an infection, as opposed to if we had more nutrients in our body. Organs will be affected, excuse me. So our eyes. Lack of vitamins can increase our risk for or accelerate the process of getting glaucoma or cataracts or macular degeneration. Okay, so not getting the vitamins that we need for that. Kidneys, the lack of fluids and electrolytes in our body can cause our kidneys to overwork. It's working really, really hard. That can lead to dehydration. It can lead to joint pain, and it will lead to heart disease. Other things that happen is our skin gets thin. It can change colors. It can be more dull or kind of gray, ashy-ish. Our cheeks can hollow out. Our hair can thin. You can even start to lose hair. It's more sparse. Nails, and you can see this in the nails, can have like a spoon shape. So like an inverted spoon shape, the opposite way nails should grow, or they could have ridges in them as well. That is a sign that you're malnourished or have a vitamin deficiency. Break really easy, brittle. But you can also become more irritable, and it can lead to depression. So this is not a normal mental, emotional functioning state for you, but this lack of vitamins, your body's not getting what it needs in your brain. So you're going to become, it can lead to depression. It can lead to anxiety, but more so depression, and just much more irritable, being more irritable. And then of course, brain health. Our brain is a pretty greedy organ. It takes about 25% of all the nutrients that we put in our body. So this 3-pound brain up here is taking 25% of the nutrients in our body, our whole body. So we want to make sure, if I want to age independently and sharply, I need to make sure my body is getting fed the right nutrients, the right minerals, the right food, so my brain can stay sharp. A loss of nutrients, a loss of vitamins can cause a loss of neurons. And when we don't have those neurons, it leads to cognitive impairment. And that includes language changes. You lose your speech. You can have poor coordination, memory loss, of course, a lack of concentration, disorientation. You're more confused. You name it, poor judgment, not able to manage your emotions as well. Personality changes can be included in all that because the brain is not getting the food it needs to function at its optimal level. So how can we help this? And we'll talk about diagnosing, and we've noticed the warning signs about this. The great thing about malnourishment and vitamin deficiency is there's ways to manage it and treat it. So one of the best things you can do is adjust your diet, make smart food choices. Get all the nutrients that your body needs. This choosemyplate.gov has a great outline, and it's easy to follow a nice visual on what each plate that I eat every day, what it should look like. And we're going to see a picture of that here in a second. But hydration is very, very important. Water is an important nutrient that our body needs. Our brain needs water, all of our organs need water, our joints need water, our muscles need water, and we need to make sure we're getting plenty of it. This is obviously, you can just drink water, but tea is good. You can get hydration through your foods also, but making sure that we stay hydrated. In this, you're supposed to drink 8 glasses of water a day. It's different depending on the person. It also depends on how active you are too. So being important of that. Really, if you're feeling thirsty or you're feeling dry, even if you're feeling tired, that might mean, gosh, I might need some water. And also a warning sign of this is if you kind of feel hungry. Well, it might not be hunger so much as it is I'm thirsty and I'm on the verge of dehydration, or I really need some water, my body needs it. So exercise. Exercise is important in the treatment of malnourishment or vitamin deficiency because it helps build muscle and it's going to help you build your strength. It increases your appetite because hunger is going to use up a lot of energy, right? So when I have that energy, I need to replace, I use a lot of energy, I need to replace that energy, and the body becomes hungry, it becomes thirsty, and you have those glaring warning signs. So it can help increase appetite and increase thirst, so you're drinking more and eating more. Want to make sure that we're very aware of what our mouth care is and our dental hygiene. Poor oral health can lead to gum disease, it can lead to other problems, but it really can limit your ability to eat well or eat certain foods that are really vital for nutrition. Because if it hurts, if it's sore, if I got sensitivity, maybe I don't have as many teeth, it's really going to impact how I get nutrients in my body because it impacts how I eat, right? Being very aware of that and just keeping everything healthy up there, in that mouth. So going back to this Choose My Plate. This is, it's the website you go to. There's a lot of information on that one website, and it leads you to different other websites with more information about heart health and brain health and you name it. But I really like this picture because you just see, it's pretty basic. There's your plate and it's broken up into quarters, right? And your 2 largest quarters are vegetables and grains. You want to make sure your plate is full of vegetables and grains, a little bit of protein, and then a little bit of fruit, and then getting some dairy. And it can be lactose or non-lactose or lactose-free dairy. You get the same nutrients from that stuff. Soy milk, almond milk, things like that. But focusing on fruits, you want to eat a variety of it. And one of the rules of thumb also on the plate is color, making sure you have plenty of color on the plate. Choose, a rainbow of colors. But natural colors is the key, not processed colors like Cheetos. It's colorful, but that's not a natural color, especially you should be eating. So natural colors, and that's meaning a variety of foods to try. We do, natural kind of raw fruits, apples, blueberries, strawberries, just eating them raw. Go easy on fruit juices or fruits that come in a can that are soaked in sugar, have extra sugar in them. We don't want to increase the sugar intake, just the sugar we get from the fruit's plenty. So, or you can eat dried fruit as well, or frozen fruit. The vegetables, especially for brain health, the dark greens are the best. But also the color. So it has in here orange vegetables, red, yellow, purple, all sorts of vegetables like that. And peas and beans are also a vegetable too. So be aware of that. And they are carbohydrates also, but they're the carbohydrates that are best for your body. The beans are. Over here on milk, you want to get your calcium every day. And this can be lactose free. There's the soy milks and the almond milks and oat milks have plenty of nutrients, have plenty of protein and all the nutrients that you need. If you are drinking milk, generally they say you want to eat some low-fat milk, but again, it depends on the person. Talk to your doctor about that. And then grains, making half of your plate grains. And this can be whole cereals, it can be certain types of rice, not processed rice, and not processed pasta or processed grains, but natural whole grains. So look for the word whole in those, and not processed, Like rice, you can get brown rice or white rice. The white rice is processed, and that processing that it goes through takes the nutrients out of the grain. And then meats. We were looking at the protein. Meats and beans is a protein as well. Excuse me, but you want to really focus on lean protein. This is fishes, maybe it's chicken or poultry. There's a lot of non-meat substitutes that are high in protein as well. So you got your tofus, your beans is a great way to get that. Grains is also a great way to get a lot of protein if you're doing some non-meat or that plant-based diet. And then on here, it talks about oils. So you want to know your fats. Because again, we're talking about nutrients. Our bodies need all these nutrients. It needs carbohydrates. It needs fats. It's just kind of what fats and carbohydrates are we getting and how much of them. So we want to make the most of our sources fatty fish that has the good fats in it, and using nut oils or vegetable oils, and not using as many butters or heavy creams, stick margarines, kind of things like that. And then I really like this. It has the physical activity in here. Know the balance between your physical activity and how much food you eat. And they suggest 30 minutes for most days. Most days is 6 days a week. Of moderately intense exercise. So a few more tips. Again, eating a variety of foods. It's going to get all the nutrients that you need, and color is the best. Remember to choose foods that are high in fiber and low in sodium, especially as we age. We really got to watch the sodium. A lot of prepackaged foods have a lot of sodium in them. So it's reading that nutrition label and being smart about what it says and really what I want to put in my body. Looking for foods for vitamin D. It's an important mineral as we age, and we'll talk more about that in a second. And the healthiest foods are whole foods. So the whole foods are often found on the outskirts of the grocery store. So they're your produce, they're your meat, your dairy sections. It's not the ends, so you're on the outside walls of the grocery store. It's where you should mostly shop. All the stuff in the middle aisles is more packaged and more processed foods. And again, it's just being smart about reading that label, how much fat's in them, type of fat, saturated fat, how much sodium is in there, and sugars as well. There's surprisingly sugars in a lot of things, added sugars. And then maintaining your weight. You need to eat the right amount of food for your age and your body. As we get older, our body does not need as much food, but we want to make sure that we're getting plenty of the nutrients for that. So we always want to talk to a doctor if we have, especially if we have any unplanned or unexpected weight loss. If we're all of a sudden having poor appetites, it is hard for us to chew or swallow. If we have ill-fitted dentures, if they're not fitting anymore, we're trying to get used to them, if that's a thing, all of that stuff can affect our eating. And we can talk to a doctor about oral nutritional supplements. These supplements have protein, they have calories, they have the carbohydrates, they have the certain fats that we need. They're all the vital nutrients that we're going to need to provide a balanced diet for individuals at any stage of life. Or you can talk to a registered dietitian or a nutritionist as well. And finding resources for other barriers that may come up. So if you are on the scale or know people that are having low income or mobility problems, transportation problems, things like that to get the food, there's food scarcity neighborhoods or areas. It's difficult for you to get to the grocery store, to drive, to prepare food, to purchase the food. You can talk to friends and family. You can look at your local church or close by church, but there's several resources in the community that can help with this. There's a couple of them, Meals on Wheels. They provide home delivered nutritious meals. They are nutrient rich meals that they provide and deliver to people, homebound people. And then there's the Supplemental Nutrition Assistance Program, or the SNAP program, and millions in the US, millions of older adults use the SNAP program to supplement their income to help pay for their monthly budget, the food budget. And food is expensive, especially when you're kind of starting to eat more healthy or get more vegetables and fruits and all that. It can be expensive. So having that extra help, you qualify for it, and it really helps with that food budget to make sure that you're getting the right foods, because it's a little bit cheaper to buy that packaged meal in a box as it is to maybe buy these vegetables and fruits and prepare the meal and do all that. So we want to make sure we are getting what we need. And then you can always call the Tarrant County Aging and Disability Resource Center, and they can give you a plethora of resources that are going to fit the needs that you have. So vitamin deficiency, just real quick, and I'm going to kind of read this off to you because this is fascinating. Vitamins D and vitamins B12 are really kind of, vitamins B12 and B6, there is a percentage of people that can become deficient in those vitamins as they get older. And that's just kind of fairly common. The body's just not producing or absorbing those nutrients as well as it once did. Not because of a condition or anything like that. It's just how the body works for some people. So you can get supplements for that. But they did a study of over 200 patients and found that 40% of the geriatric memory patients were deficient in at least one vitamin linked to brain health. This is the vitamins B12, vitamin D have been shown to link to brain health, and vitamin B6. So 37% of the patients were deficient in B6. B6 is critical for the synthesis or the workings of neurotransmitters like serotonin, dopamine, and epinephrine, as well as the making and workings of hemoglobins, which is in our red blood cells. 33% were deficient in vitamin D. Vitamin D contributes to healthy bones, skin, and metabolism, but there's also a lot of studies coming out fairly recently that it's important for brain health. And then vitamins B12, these are common, the levels of B12 are commonly tested in older patients, but only 16% were deficient. But the less commonly tested vitamins B6 and D, those deficiency rates were much higher. And that's not a common vitamin that gets tested in elderly patients or the older adult. So I'm just going to read this quote on one of the researchers that did the study. So our study shows that many memory patients do have significant deficiencies in vitamins that affect their memory. Treating these deficiencies is critical for improving memory function and an efficient response to memory treatments. So not only is it critical for me to age brain healthy, but if I'm already having some cognitive impairment or some memory issues, making sure I am not deficient in these vitamins will help those symptoms be better for a longer period of time. So in the elderly undernourishment with regards to B12 and B6 and folate may occur and show some neuropsychological deficits, the same deficits that affected younger women that were struggling with anorexia. And then if you're not absorbing fats, you're not absorbing certain vitamins, usually relative to starvation, gastric bypass surgery, or you have an IBS, an inflammatory bowel disease, that can also lead to cognitive impairment. So if you have anything like that, you're not absorbing the vitamins and fats you need, and other nutrients can lead to cognitive impairment. And then niacin deficiency, and it's pellagra. I don't know if I'm pronouncing that right, but it is a condition that some people can develop that causes some dementia-like symptoms, diarrhea, and dermatitis. So niacin or vitamin B5 is found in whole grains, nuts, that lean protein fish, and it can be, so this is interesting, it can get deficient if you have a high intake of corn and things made with corn, but symptoms are loss, rapid weight loss, diarrhea, fatigue, and some severe loss of memory. So they are suggesting, and several studies say the same thing, that the Mediterranean diet is the best diet for getting these vitamins. And the Mediterranean diet has also been heavily shown to reduce your risk for developing dementia and Alzheimer's disease. They go hand in hand, it kind of works out. But we do want to talk to our doctor before we start taking any supplements or changing our diet or doing anything like that. So just real quickly, supplements that they suggest. To take a supplement or get a supplement, you want to talk to the doctor, but you get the vitamins and the nutrients better from your food. Your body just absorbs it and metabolizes it differently than it does taking it from a supplement or a pill. And also the supplement industry is not really regulated. So you want to make sure that you're buying from a reputable source, or you can ask the doctor or the pharmacist which would be the best one to buy. So folic acid was mentioned, and this is essential to brain health and emotional health. And it helps with the neurotransmitters in the brain. And it's been shown that some people that have low levels of this do have symptoms of depression, problems with sleep, confusion, appetite loss, nausea, etc. And you can find these in more plant-based foods, so chickpeas, dark leafy greens like spinach, kale, beans, asparagus, whole grains. And we've talked about B6 and B12, but these are just where you can get those through your food. And hopefully that can help you not be deficient in those, but you're getting the vitamins and nutrients that you need. And vitamin E, also some research suggests that those who eat a diet with high vitamin E are less likely to develop dementia. Not all studies have found this, but also not all studies are looking for this. So you can add more vitamin E to your diet through certain sunflower seeds, oils, almond butter, peanut butter, spinach, broccoli, and then vitamin D, important for bone health and calcium and metabolism, but brain health as well. And there are many reasons, which include obesity, poor diet, and lack of sun exposure that can make you deficient in vitamin D. So you can get it through the sun. Your skin is absorbing the sunlight, but you can get it in oily fish, eggs, mushrooms, things like that. And to get diagnosed, to see if you are really deficient in something, if you are malnourished, you're not getting certain nutrients that you need, it's through a variety of lab tests, and they check all of these levels. They'll check red blood cell counts, white blood cell counts, serum lipid levels, vitamin levels. And you want to ask, I want you to check for B12, but can you check my B6 and vitamin D levels too? Ask them which levels are they checking, or which vitamins are they checking. So creatine, visceral proteins, they're going to check your blood nitrogen and urine as well to rule out, here's, yes, you might be deficient in this. Let's get you on a treatment plan. So there are the references that we had for this and more information. I know I'm a couple of minutes over, but does anybody have any questions or concerns or anything they want to share?
Jamie, this is Carolyn. I would like to just emphasize for those who may not have experienced this, how critical the vitamins can be. Now, that doesn't mean that they make dementia go away, but when they were first trying to see what was going on with Boyd, the very first day we saw the neurologist, they said, we're going to do these tests, but we want you to go home immediately and get vitamin B12 and vitamin D3 supplements and start taking them. And this is literal, I promise, within about 3 days, we saw improvements. Again, that doesn't say he didn't have dementia, that continued, but it was almost day and night in what we saw within a very few days of him starting supplements. High, of course, that was a neurologist, and they were very high levels of supplements, not the kind that you would want to do without talking to a doctor. But
thank you for sharing that, Caroline. Yeah, that just goes to show, and you get up a good point. They're very high level supplements that we want to take, and that's generally not what you're getting over the counter. So if you are truly deficient or are having a hard time, the body's not absorbing it, you do need to talk to a doctor about getting a prescription vitamin supplement. But that's good to know that the turnaround, the improvement happened in just a few days. Well, I appreciate y'all's time. Sorry I went a few minutes over, but I will send you out the slides, a copy of the recording, and our upcoming programs this afternoon. Thank y'all so much.
Thank you, Janie.